Hi, Dr. Mancini here, and I want to give you a little gem about what I call the principle of modeling, because I believe that if you model people that have what you want, you'll get what they get or something similar. So when I see a pattern, especially in my clinic, where you see a certain characteristic of patients that make the most successful, biggest changes, you want to figure out what they're doing and you duplicate what they're doing or something close to what they're doing. So with that said, I've seen patients who come in here and they get to a point, they go, you know what, I am done. I am sick and tired of being sick and tired. I'm no longer going to deal with what I've been dealing with. I'm no longer going to deal with what I'm dealing with now. And I can't imagine another moment I'm going to make a change. And that's the intensity that they come into our center with. And they know that if something's going to change in their health, they have to be the one to make the change. It can no longer be dependent on anyone outside of them. They have to stop blaming. They know they have to stop complaining. They know they have to stop giving excuses. In other words, they come to the realization that they need to own every aspect of their health. Now, we're not talking about blaming. We're just talking about taking on responsibility. Stop looking outside and start looking on inside of what you need to do to make the change. Now, that person could be right here, right now, listening to this video. And I will tell you, that is not a place of weakness. That could be a place of your greatest strength. If you take that raw emotion, which is usually fear, frustration, anger. I mean, it doesn't feel good, but it's raw sensation. If you take that and you take that fuel, because it's fuel, and you focus it on an outcome, on what you want, not on what you don't want. We know what you don't want. You have a diagnosis, you have a symptom, you have something that doesn't feel good. Don't need to focus on that. You need to focus on what you want. And once you get really clear on what you want, and you have someone that can help you, and this is what we do, is we chunk it down and we reverse engineer it. And then we chunk down your big goal into achievable smaller pieces. Because at every step you want to be successful. As you start to feel successful, you start creating momentum. When that happens, what we see is that these folks who come in a place of desperation, they start to feel inspired. They start feeling compelled. They start not needing so much to push themselves. They start feeling like they're being pulled. And when that happens, that's when the big shift occurs. But it takes that mindset. It takes that level of, you know what, I am done. That mindset, we can make the biggest changes no matter who you're working with. Now, you're working with a team like us, you're going to get there faster. But either way, you are going to get there. It's just about how fast you want to get there. So most importantly, bottom line here is that you want to model people that have what you want. And if you do, you'll get what they get or something similar. I've seen these patterns over the last 20 plus years of my practice. And I want to extract those components and teach you these principles so you don't need to spend 20 years of figuring this out. So hopefully that helps, gives you some insight. If you have more questions, email me or speak to me in clinic. Thanks.